We get sick, we go to the doctor, and if we're lucky, we get diagnosed early and don't wander aimlessly for years, only to eventually be told that there is no cure. That's that. So, what's this talk about people recovering? I thought there is no cure. How is that possible? Did these recovered people really have the illness? Did they find the secret cure? What's going on? Well, it's confusing, isn't it? And to be frank, I never had that problem because when I was sick, I didn't know that recovery was possible. That's why I started to share recovery interviews at a time when no such thing existed on the internet. A decade later, the internet is full of such stories. But big questions remain. Now, it's important to realize that these sort of contradictions can really halt us in our tracks. They can waste years. So it's essential, it's critical that you get this right now. Getting educated, understanding how this works is centered to you making changes to improve your well-being now. That's why the ANS Rewire education and training program has received praise and referrals from doctors from all over the world and is supporting patients now in over 60 countries in their recovery since 2016. Okay, so let's get into it. Let's start by acknowledging the fact that there is no cure for fibromyalgia, ME, CFS, POTS, multiple chemical sensitivity, or related syndromes. However, the first problem is this misconception about cures. This is a word I really don't like. I don't feel that the idea or concept that it provokes in our minds is something that exists for many, if any, conditions. Now ask yourself, what treatment do you know of that cures a condition? Maybe a bacterial infection with antibiotics. But then how do you know it won't come back in a week or two? Just ask someone experiencing chronic ear infections whether they see that treatment as a cure. Even something more absolute like appendicitis. Is surgery a cure? Well, it's hard to imagine getting appendicitis twice, but you could get a stump infection. And you've got a pretty good chance of developing adhesive disease. So you could say it's a cure, but the cure might create another disease. And what illnesses are there cures for? Diabetes? Parkinson's? Alzheimer's? MS? Heart disease? Where are these magic cures everyone's speaking of? My question is, why do we even use this word? Let's look at cancer, for example. Some treatments are described as cures when a patient is in remission for 5 years. But is that really a cure in the way that we think about it? If someone's sick 5 years later and dies, do you think that's really what a cure is? Even simpler things like a broken arm or a cut. Where are the cures? There's not many cures, right? But we do have treatments. Sometimes very helpful treatments. Sometimes less helpful treatments. Getting your arm set correctly to ensure your body can heal it. Wow, that's really amazingly important and helpful. But is it a cure? Ultimately, it's your body that has to do the healing, right? Hopefully, as you reflect on this, you realize that this idea of cures is a bit misguided. So perhaps it's time to let go of this idea of waiting for some magic cure to arrive. That's not to say that we can't find more effective treatments. Absolutely not. If you have followed the podcast, you will have heard some of the amazing breakthroughs by top scientists, and physicians from around the world. But what is really important to understand is that none of these treatments improve all patients equally. And perhaps even more important for this group of illnesses is realizing that we can actually recover our health, we can return to normal functioning without the existence of some magic panacea cure. Surprised? Shocked? Confused? Okay, so let's explore how this is possible. And rather than coming at it from some complex technical description for the pathogenesis or pathophysiology of the illness, which you can see in the explanation videos or the ANSBY intro lessons, both which will be linked below here, I'm going to explain it from a common sense perspective. Specifically from your perspective, your day-to-day experience that you have most likely had if you have one of these illnesses. So, these are things that you know to be fact-based, things you know to be true from your everyday experience. So let's start with these considerations. If you've had this illness some time, you will have noticed that certain things make you feel worse. These things are called triggers. They might be things like doing too much physical activity, exercise, or physical work. Or it could be other physical triggers like getting an infection, which can happen a lot if the immune system isn't working quite right. Or they could be things like eating certain foods, skipping meals, eating too much. Other triggers might be mental activity, like studying or something else, some other kind of mental concentration. Or it could be other jobs that you do. Mental strain can also include talking with people, being in busy places or being on a computer or a phone. And that starts to take us into other triggers, neurological triggers, where things can start to get a little bit weird. So we're talking about things like too much noise, too many bright lights, even smells, or even seemingly unnoticeable things like barometric pressure changes when the weather turns. So, at times, these triggers seem to be worse than others, yes? So sometimes you experience these triggers even slightly and you get a big flare-up right away. And at other times, you're not so sensitive. Now these periods when you are not so easily triggered into flare-ups or worsenings are often times when your overall health has been a little bit better. The vast majority of people notice that over time there are periods where they are worse and periods where they are a bit better. So we know for a fact that things can be better, at least for a time. Now there are many triggers, but if you learn what your specific triggers are and you reduce your exposure to them, then it goes to follow that you will feel a little better. That's a recovery action step. And you may even notice that when you're not triggered into flare-ups all the time, then you start to feel better overall. And also, you're not so easily triggered into flare-ups. So that's starting to build resilience. And this represents your nervous system learning to react differently to these stimuli. You might describe this as a partial recovery. So, presumably you have experienced or seen others experience how at some time there was a significant amount of recovery progress. You may have seen people go from being bed or housebound to starting to function more normally. They're not cured, of course. They still get flare-ups. They still have symptoms. They still need to be careful about what they can do. But they can do a little bit more. In fact, sometimes a lot more. And if you have listened to the recovery interviews, you will see how people build such progress by addressing their individual triggers. Let me say that again. You will see how people build such progress by addressing their individual triggers. Now, let's have a look at what learnings you can gain from some examples. If a person that progressed with their recovery was triggered by a bodily dysfunction from the illness, such as severe gut dysbiosis or parasites, and they progressed by treating these gut issues, that makes sense. But of course, if your gut is fine, then of course such a treatment isn't going to benefit you. Or if a person that progressed with their recovery also had PTSD, severe anxiety or depression, and these problems triggered their symptoms and led to flare-ups, well, if you don't have such issues, then of course such treatments aren't going to work for you. So hopefully it's becoming clear why we don't have some panacea, one-fits-all cure. It's about a tailored approach. That's why when somebody gets better with their amazing cure, it tends not to work for you. But it doesn't mean that it didn't work for them. Or it doesn't mean that they didn't have the same illness as you. It just means they had different triggers. We have to address our individual triggers and dysfunctions. Removing triggers and recognizing that people can improve their well-being is only part of the answer, isn't it? The question is, how is it possible that people make a full recovery and no longer get flare-ups when they are exposed to triggers? And does that mean that they can't get sick again one day in the future? Well, we already know from our own experience that at times we can be less triggered into flare-ups and sometimes more triggered. So full recovery is really just an extension of this, where we go from being very triggered to being less triggered to perhaps being only slightly triggered to not being triggered at all. But the big question is, why do these triggers and flare-ups exist in the first place? The issue with these conditions is that not only are there many physical dysfunctions in the body, which vary between patients, but there also is a problem with the nervous system, which is driving these dysfunctions and which is behind this triggering. The nervous system controls your hormone levels, your immune system, your gut function, your heartbeat, and so on. It controls all the bodily processes via the autonomic nervous system. So whilst the way the nervous system can react to triggers can change over time, focusing on helping it to behave normally is key for people's recovery. And this is called neuroplasticity, the ability for the nervous system to change how it functions. In fact, unhelpful negative neuroplasticity is what led to this problem in the first place, to a state where you experience central sensitization, and hence the increase in symptoms like pain, uncomfortable feelings in your body like in your gut, discomfort around stimulation like on your skin, or sounds, lights, smells, and so on. With these insights, the stories you hear about people making partial or full recoveries will hopefully start to make more sense to you. The people that recover clearly address their individual triggers, reducing the noise on their nervous system, so to say, allowing their nervous system to become less reactive. In many cases, they actually do focused training on their nervous system to help the process along. I encourage you to check out the old explanation video series on YouTube, or the more comprehensive free ANS Rewire intro lessons to understand more about how all this works. And of course, check out all the recovery stories. You'll see I'll go into a lot of detail, really teasing out how people exactly got ill, what their symptoms are, and what they did to recover. And as you learn more, you'll see that what they did is often more than the obvious steps they describe, and how it usually contains some kind of neural training to affect neuroplasticity, whether they realize this or not. So we're not talking about cured, we're talking about recovery, we're talking about being fully well again. Does that mean that somebody would never be able to get sick again? Of course it doesn't. But it means that we can get our lives back. Both partial and full recovery, of course, have value. So, what do you think? Does that finally make it clear for you how people recover even though we have no cure? Do you still think that you need to hold out for some cure? And do you think it's likely to happen anytime soon? I'd love to get your thoughts and maybe share your thoughts about what other people are thinking. Until next time, I remind you to prioritize yourself and your well-being and to learn how the process of recovery occurs. And remember, always be kind to yourself. Just before you go, please take a moment to leave a comment, and if you like the video, give us a thumbs up and subscribe to the channel.